First Glance with Jody Vance. I am absolutely thrilled to welcome back to the program, probably our most oft-returned guest, I think, Dennis Hancock, the CEO of Mountain Valley MD, a company that I looked back. Our first glance was December 1st. Like we go way back to 2020, Dennis, but you've got some big updates to give us today. But before we get there, for somebody who hasn't looked at the history of MVMD, that's the stock symbol MVMD. If you haven't looked at the history of First Glances, I think the videos are over there. Are they down there? I think. Google them and look at them because you want the whole story and get the science behind what we're about to talk about. But the big news has to be at the head of this particular episode. What is the latest, Dennis?
Thanks. Great to see you, Jody, by the way. Always nice to catch up. Yeah, so this is a very exciting media release that went out, essentially introducing a couple big things that we're doing inside of Bangladesh. And, one thing I would start is Bangladesh is, a country with essentially half the population of the United States. Most people really don't realize how populous it is and, how large even the animal market is that we're going after there. And then, of course, the human application. So that's setting the table. What's really exciting is we're working directly with the Bangladesh government, a couple of ministries in particular, fisheries and livestock, and then, of course, the Ministry of Health. And what's really important about that is we're doing trials that they're directly overseeing in their facilities on husbandry animals. And that includes, in this particular study, cattle, goats, and poultry. And the benefit of working at this level is we're not essentially going to a third party, normal CRO, if you will, that would come in and present data, and then you're lobbying that data in and, working through a process that takes quite long. We're actually working with people at the table who are very motivated and excited about our investments inside Bangladesh and the opportunities to make a significant difference in their entire husbandry animal category for farming and all of that. So really cool, really exciting. Cool. Yeah. And I think the other part of our release, sort of to connect the dot for your viewers, we are striking pharmaceutical agreements as well for our production side of it. So wow, these trials, and we've already been seeing just explosion of evidence around ivermectin. These trials, in my opinion, are a laydown given we've already seen the safety and the efficacy of ivermectin. And when you can take a solubilized form out of that, we've already proven in our preclinicals that we can drive an unprecedented pharmacokinetic reaction with our solubilized ivermectin. And then we also have a dose-sparing lane to that, so 1/5 or 1/8 of the ivermectin drug. So now we're going to put that to the test in a real environment. And the other benefit of soluble ivermectin is we can now go down in animal classes. So poultry is significant. It introduces 60+ billion injections that don't currently exist in the world today. So people that are trying to understand our business plan and where we're headed, we're not just sort of catching up to a market, we're inventing an entire new market. And in this particular trial, we're doing needleless injector applications. So it opens up a follicle the size of a hair, injects in our Ivectosol, which is our solubilized ivermectin, and, with a precision, 0% variability, and all of the benefits that we've previously touted. So lots of really amazing things, and then link that to a pharmaceutical production lane. We're just getting started, is how I would say all that.
It is so exciting, Dennis. It's exciting to watch the trajectory of MVMD. Again, the stock symbol M, V as in Victor, M, D as in David, Mountain Valley MD. Dennis Hancock is the CEO. And we've been talking so much about ivermectin. It's secondary nature now for, as you're explaining, the solubilized ivermectin technology, the Ivectosol 1%, and the administering of it. And because in our past episodes, you've referenced, how getting the ivermectin, or the now Ivectosol, which is the into the animal was the challenge, or getting it to the far-reaching places, the corners of Bangladesh, in a way that is transportable, that is effective in getting. And I, when I tell the story, I love to talk about what you've taught me about the dehydration, and then being able to transport that rehydrated, the solubilized, or utilize it in a dissolvable, which in some areas of this planet, water is the biggest currency to try and get fresh drinking water. And when the water piece isn't as necessary, like there's so many lanes of what MVMD is in, and as you said, creating new lanes and new businesses and new realities, that you're just not going with the whole old standard of the 1980, what was it, 1982 approved World Health Organization, drug in ivermectin, that it was already proven and used and safe and cheap and available. But you've taken it to a whole new level with your technologies.
Yeah, there's a tiny peek in it looks like a throwaway line in the press release, but there is a little hint around some of the things you just said around the human applications, although these immediate trials are focused on that, around animals. The human element is exactly what you just described. Although the injectable format will be amazing for frontline, health situations, for virus, clearing the COVID is, of course, the number one headline, but of course it has all sorts of therapeutic benefit across lots of viral outbreaks. But the cool part is the solubilized format that gets laid down through our desiccated liposome that you've been describing, that will be administered sublingually. Again, a rapid dissolve, chiclet size piece that dissolves into your tongue. And we've already proven that uses 1/5 of the ivermectin API and is effective within an hour versus 6 hour to current format. So very exciting.
Yes.
Water. So water in some countries is worth more than the low cost of ivermectin. So there's some pretty cool things that are coming there as well.
It is just really absolutely inspired watching the evolution of this, the things that traditionally take an incredible amount of time. I think it's very important to reiterate what you said about the involvement in Bangladesh with the government at the government level, and having the varying health ministries at the table, actively cutting through the red tape and the processes that have traditionally been, epic in trying to navigate. And here you are sort of cutting through that out of what we've learned over the last year and a bit, and the necessities that come along with it, and the technologies that have been developed by MVMD.
Yeah, it's really interesting. You sort of bring up the political landscape in North America. I'm the most shocked when I first met Dr. Corey and some of the battle. Him and I exchanged a nice text yesterday, just congratulating him on the work that his team has done. And they have a very important published document that came out yesterday with a lot of work, but really just validating the global acceptance of ivermectin and its safety. And mind-boggling that he had to work that hard for that. But I have to say, it's been incredible to be working inside countries that frankly are a beachhead for all, the Southeast Asia, Africa, all of that is why we're excited about Bangladesh. But they're motivated, to make a difference, save lives, have drugs be effective. They're not motivated initially by where profits lie and, where companies make money. And so that's a more complicated interview and discussion, and not something I get too focused on, but I get super excited when we're aligned politically with someone, organizations that just said, let's make a difference. Let's make sure the people most in need get what they need and let the rest look after itself. And that's why this is extra exciting.
It will all fall into line, because at the root of all of this, the money or the profits come when the people and the animals frankly, whatever the farming might be, however the land use or the animal use might come into play, a healthy country depends on healthy citizens and healthy farms, and that is at the root of what MVMD is doing on a global scale. And we often say here in Canada, we're so lucky with the access we have to medicine and to veterinary medicine, for that matter, and husbandry and all the rest here in North America. It's a totally different ball game elsewhere. And as we hear the term more and more with the rollout of vaccines for COVID-19, none of us are safe until all of us are safe. And that feels to me what MVMD is on a mission to do, is just to spread the safety on a global scale.
Well said. Perfect.
Okay, well, bye.
Well, I could talk for an hour,
but
yeah, I respect your time. But you did, you know, I think that is a good spot to wrap, in the sense of what is it we're trying to accomplish, and the hint you just made about the relationship between animal health and human health. We have been so squarely focused on that. The reservoir of disease that happens inside animals, the massive impact in third world country to the death and the loss of husbandry animals, which a lot of the livelihood relies on, direct, you know, relationship to GDP. And, you know, if these countries can start spending money on schools and wells and, you know, all of the things that we take for granted in electricity infrastructure, rather than just catching up from disease and fighting, you know, a healthcare system, that is, you know, we couldn't be more aligned and excited to be able to start working on those problems.
And we love that at Equity Guru, and we love that here on First Glance with Jody Vance, because there are a lot of people that tune in to this because they're looking for investments that fit and align with their ethics. And certainly MVMD has proven to be one that is doing that. And the success rate is great for the big investor as well, that isn't as concerned with such things. And not everybody needs to be, but it's good to know that there is a sort of a shift in investment toward that. And Dennis, you're certainly a great example of somebody who's putting forward the positivity in a very straightforward way. And I'm absolutely, it's weird that I want to say I'm proud of you. Is that?
My parents
are
to
know you. There you go.
Yeah, no, it's cool. And it's a good reminder of, you know, being a leader in this type of company, how proud I am of the team. And I talk often about change makers and the talent we attract, and they don't all sit and work for me. They're people that help our company. You know, we have lots of suppliers and partners and new government relationships, and these people with the foresight to make a difference is exactly why I'm proud to be doing this job.
That's high fives all around. I'll see you next time.
Awesome. Thanks, Jody. Great to catch up.
Always a pleasure. MVMD, look it up. Trust me, you'll like the story, and watch the other ones that are down here or over there. I can't remember. That's it for now.